feelings of sadness, hopelessness, or guilt, insomnia, difficulty coping with normal life activities, social avoidance, and anxiety after giving birth are all signs of what? A. Postpartum psychosis. B. Postpartum anxiety. C. Postpartum depression. D. All of these answers are correct. The answer is C. Postpartum depression. Feelings of sadness, hopelessness, or guilt, insomnia, difficulty coping with normal life activities, social avoidance, and anxiety after giving birth are all signs of postpartum depression, a condition that affects as many as 4 out of 5 people after giving birth. Postpartum psychosis is a much more serious condition, involving delusions, extreme mood swings, and risk of self-harm. What is the cause of postpartum depression? A. An extreme drop in hormone levels. B. Specific vitamin deficiencies. C. Lack of sleep. D. Social stress. The answer is A. An extreme drop in hormone levels. While vitamin deficiencies, lack of sleep, and social stresses can all contribute to depressed mood after giving birth, the primary cause of postpartum depression is an extreme drop in hormones, primarily estrogen and progesterone, that occurs after delivery of the placenta. A first-time mother comes in 10 days after giving birth to a healthy daughter. She is concerned because she has been bleeding continuously from her vagina since labor. The blood is red to brown, and she has been using sanitary napkins, which she must change about every 3 hours. How do you counsel her? A. This is an emergency, refer to urgent care. B. This is normal bleeding as she expels the remains of the content of her uterus after labor. C. This is normal bleeding most likely due to the sudden drop in her progesterone levels. D. This bleeding is abnormal and may be signs of a mild uterine tear. The answer is B. This is normal bleeding as she expels the remains of the content of her uterus after labor. Postpartum bleeding, referred to as lochia, is a normal process wherein the individual sheds blood, mucus, and uterine tissue after delivery. This bleeding can continue for up to 6 weeks, and coloration can change from bright red blood, lochia rubra, to pinkish brown discharge, lochia serosa. A new mother comes in 2 weeks postpartum. She is complaining of left breast tenderness and heat. On Pu note the slightly enlarged left breast that is mildly erythematous and very tender on palpation. This is most likely what condition? A. Fibrocystic breast disorder. B. Ductal carcinoma. C. Mastitis. D. Benign cyst. The answer is C. Mastitis. Mastitis is an inflammation of the breast tissue, often due to milk stasis in a breastfeeding individual and occurring most commonly in the first few weeks after delivery. Causes can include poor latching, tight bras or clothing, or infection. Incidence is higher in individuals who are immunocompromised, and in people with cracked nipples or past history of mastitis with a previous birth. Mastitis is not an emergency, nor is it any type of cancer, cyst, or serious breast disease. How long will the umbilical cord stump generally remain on a newborn? A. 4 weeks. B. 1 week. C. 2 to 3 weeks. D. 2 to 5 days. The answer is C. 2 to 3 weeks. The stump of the umbilical cord will generally remain for 2 to 3 weeks after delivery. During that time the stump's coloration will change from blue to black as it dries. Eventually it will fall off much like a healing scab, leaving behind the umbilicus, navel. The nurse cares for a 2-year-old boy whose mother is worried that he is not fully toilet trained yet. The mother is worried because he is not yet able to hold his urine for more than a couple hours, but is proud that he can use the toilet for bowel movements. How should the nurse reply to the mother? A. Your child could be developmentally delayed and should have achieved full toilet training by now. Let me refer you to a pediatric psychologist. B. You should tell your son no every time he wets himself. That is the only way he will learn that his behavior is not acceptable. C. Bladder control is usually achieved before bowel control, but he is on track to become fully potty trained. D. Bladder control is usually achieved after bowel control, but he should be fully potty trained by this age. E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. The answer is E. Bladder control is usually achieved after bowel control, so toilet training can take anywhere from 2 to 3 years to fully achieve. Toilet training may be achieved anywhere from 24 months to 36 months, and may sometimes take longer for boys than girls. Bladder control usually occurs after bowel control. Parents should not be concerned if their children take the full 36 months to become toilet trained or if they have difficulty holding their urine longer than a few hours due to the small size of their bladders. Toilet training that takes longer than 3 years may be caused by psychological factors, but this child is not in need of the assessment of a child psychologist at his age. The nurse should not encourage the mother to tell the child that his behavior is unacceptable because it is not expected of him to achieve full toilet training for another year. What is a normal hematocrit for a newborn? A. 45 to 65%. B. 60 to 80%. C. 35 to 40%. D. 50 to 75%. The answer is A. 45 to 65%. Normal hematocrit in a newborn is 45 to 65%. This is measured via heel stick just after delivery. This test is useful in assessing for anemia, suggested by a low hematocrit, and polycythemia, suggested by a hematocrit over 65%. Which of the following should be encouraged in a person presenting with mastitis? A. Go to urgent care if a high fever develops. B. Wear a loose-fitting bra. C. Breastfeed as much as possible. D. All of these are correct. The answer is D. All of these are correct. The most common treatment for mastitis is frequent breastfeeding, along with rest and loosening of any tight-fitting clothing. Most cases of mastitis are non-infectious and do not require antibiotics. However, high fever can be a sign of infectious mastitis, and may require pharmaceutical intervention. At what age does an infant learn object permanence? A. 6 to 8 months. B. 2 to 4 months. C. 3 to 5 months. D. 5 to 6 months. The answer is D. 5 to 6 months. Object permanence is the understanding that an object still exists even when it cannot be seen, heard, or touched. It is often tested by placing an object on a surface, then covering that object and allowing the infant to attempt to uncover it, thus demonstrating a knowledge that the object remains present though it is hidden. Which of the following is not a part of the Apgar score? A. Appearance. B. Respiration. C. Activity. D. Gurgling. The answer is D. Gurgling. The Apgar score is a test of newborn health and physical function, designed to assess a newborn for need of emergency assistance. The factors used to calculate the score are the following: appearance, pulse, grimace response, activity, respiration.